Hi, we're going to be talking about Chapter 5, the cardiovascular system. Let's take a look at our related combining forms for this chapter. We have the heart. Combining form is cardo and cardio. Blood vessels is angio and vaso. Arteries are arterial. Capillaries are capillo. Veins, you got two for veins, flebo and veno. And then blood is hemo and hemato. So those are your new combining forms for this chapter. So the functions of the cardiovascular system, what it does is consists of the heart, blood vessels, and blood. Looking at the term cardiovascular, we can break that term down. Cardio is heart, vascular is blood vessels, and AR is pertaining to. The functions of the cardiovascular system, obviously we have the blood. What this is liquid tissue. It transports oxygen, nutrients. It also returns waste products. It carries the carbon dioxide, and it is very important in immune and endocrine systems. Next, we have heart. You can see the two combining forms for heart are cardo and cardio. It is a muscular organ. It furnishes power to maintain blood flow. And then we have the pericardium, which is a membranous sac enclosing the heart. Looking at that term, pericardium, we can break that term down. Peri is surrounding, cardi is heart, and is singular. It's just a singular noun ending, pericardium. We have the epicardium. It's an external layer. We have the myocardium, which is the muscular middle layer. And then we have the endocardium. This is the inner lining. And each one of these terms, epi is upon, myo is muscle, and endo is within. Here's a figure here. This is the anterior external view of the heart. So you can see where they all are located. And this figure here is an anterior cross-section view of the heart, which is the cross-section you can kind of see inside the heart. Right ventricle, right atrium, left atrium, left ventricle. So the coronary arteries supply the oxygen-rich blood, and the coronary veins then remove waste products from the myocardium. The myocardial, which beats constantly, must have a continuous supply of oxygen and nutrients, plus prompt waste removal to survive. We have the atria. All blood enters heart through these upper chambers, and the ventricles then are the two lower chambers that pump blood throughout the entire body. Here's a figure of that. This is the anterior. You can see the mitral valve, pulmonary semilunar valve, aortic, and the tricuspid. So next we have the valves of the heart. We have the tricuspid valve, controls opening between right atrium and left ventricle. It does have the three cuffs or points. Then we have the pulmonary semilunar valve. This is between right ventricle and pulmonary artery. Pulmonary is pertaining to the lungs, breaking that term down. We have the mitral valve. This is between the left atrium and the left ventricle. And then we have the aortic semilunar valve. This is between the left ventricle and the aorta. Systemic and pulmonary circulation. We have the pulmonary circulation, which just means flow of blood between the heart and lungs. And then the systemic is flow of blood to all parts of the body except the lungs. You can see here in this figure, blood is pumped through the systemic and pulmonary systems. The blue here is the oxygen poor blood, and then the red is the oxygen-rich blood. Together, the blood in these systems brings oxygen to the cells and removes the waste products from the cells. Next is the heartbeat. So the heartbeat is the pumping of the blood throughout the body by contraction and relaxation of the heart. Rate and regularity determined by electrical impulses to the myocardium. Conduction system of the heart is the SA node in the posterior wall of the right atrium. This is the heart's natural pacemaker. We have the atrioventricular node, or the AV node, that's on the floor of the right atrium, and then we have the bundle of His within the interventricular septum. We have the Purkinje fibers. These are within the walls of the ventricles. And the conduction system visualized as wave movements on EKG or EEG is what this would be. So the Purkinje fibers stimulation causes ventricles to contract. Here's a picture or a figure of the SA node, which is right here, AV bundle. And we have the AV node here with the bundle of his, right and left bundle branches, and the Purkinje fibers right here. So the arteries carry blood away from the heart. The aorta is the largest artery in the body. The arterioles, these are just the small arteries, and they carry blood to the capillaries. There are three types of blood vessels: arteries, capillaries, and veins. So the capillaries deliver oxygen nutrients to the cells, venules are the smallest veins, and the veins then carry blood toward the heart. Valves prevent backward or backflow of blood. We have pulse and blood pressure. This is just a rhythmic pressure against the walls of the artery. These are caused by contraction of the heart. So the blood pressure is the monosystolic and dystolic pressure exerted against the walls of the artery. So we have systolic and diastolic pressure. The systolic, the ventricles contract, and the diastolic, the ventricles relax. Next, we'll move on to the blood. The blood is composed of plasma-informed elements. The blood is a fluid tissue in the body. It's composed of 55% liquid plasma and 45% formed elements. So we have the plasma contains nutrients, hormones, waste. We have serum. Plasma is just minus plasma. Serum is just plasma minus a clotting factor. And then we have the fibrinogen, it's clotting proteins in plasma. Formed elements of the blood include erythrocytes, leukocytes, and thrombocytes. We'll take a look at each one of these. So the first one we have is erythrocytes. And looking at the term erythrocytes, we can break it down. Erythros, red, cytes is cells. So these are just mature red blood cells produced by red bone marrow. They do transport oxygen to tissues. And also, let's just kind of take a look at the term they have here, hemoglobin. So hemoglobin, their definition is it's just oxygen carrying blood protein pigment. So hemo is blood, globulin is protein. We have leukocytes, leucose white. So leukocytes defend body against infective organisms and foreign substances. Neutrophils, the immune system defense. We have basophils, cause symptoms of allergies. Eosinophils, destroy parasite organisms. Lymphocytes produce antibodies, and monocytes, these are immunological defense. So these are the major groups of leukocytes: neutral, basal, eosinophils, and lymphocytes, monocytes. And then the last one we have is thrombocytes. Thrombo, looking at that term, you can break it down. Thrombo is clot. The smallest formed element, its important role in clotting of blood. Thrombocytes are also known as platelets. And here you can see the figure here, the major fluid and formed components of blood. So you have plasma, 55% of total volume, formed elements, 45% of total volume. This is where your neutrophil, basophil, eosinophil, lymphocyte, monocyte. Your leukocytes are your white blood cells. You have your erythrocytes and then the thrombocytes with your platelets. Let's take a look at blood types. They're classified according to presence of or absence of certain antigens. So listed as A or B, AB, O, followed by the RH factor. RH defines presence or absence of RH antigen on red blood cells. So you can have a RH antigen present, which is RH positive, or it could be absent, which would be RH negative. About 85% of Americans have the RH antigen, and these individuals are described as being RH positive. The remaining 15% do not have the antigen, the RH antigen, and are described as RH negative. Blood classes, These are gases normally dissolved in the plasma. Major blood gases are oxygen, carbon dioxide, and nitrogen. Okay, let's take a look. They've got some listed medical specialists related to the cardiovascular system. The first one was cardiologist. Um, Looking at the term, cardi is heart, logist is specialist. So they diagnose and treat abnormalities of the heart. You have a hematologist. Um, they diagnose and treat abnormalities of the blood. And then a vascular surgeon. They diagnose and treat disorders of the blood vessels. The pathology of the cardiovascular system, congenital heart defects. These are abnormalities present at birth. They may be apparent at birth, they may not be detected, or they may not be detected until later in life. Coronary artery disease, or CAD, is the most common type of heart disease, causes insufficient supply of blood, and may cause angina, myocardial infarction, or death. We have atherosclerosis. Breaking that term down, athero is plaque or fatty substance. Sclerosis, abnormal hardening. So it's hardening, narrowing of the arteries. And this atherosclerosis is caused by buildup of plaque on interior walls of the arteries. We have ischemia. ISCH is to hold back, emia is blood. So ischemia is due to restricted blood flow. This causes insufficient supply of oxygen to the tissues. Angina, also known as angina pectoris. This is inadequate blood flow to the myocardium, may lead to a myocardial infarction. Myocardial infarction then is an occlusion of one or more coronary arteries due to plaque buildup. Damage to myocardium impairs the heart's ability to pump blood throughout the body. Frequent symptoms, if you're having an MI, is pain or pressure in the middle of chest. It may spread to back, jaw, or left arm. And it may also be asymptomatic, also known as a heart attack. Heart failure, this is also known as congestive heart failure. It's a chronic condition. The heart is unable to discharge all the blood it receives, resulting in congestion. Maybe on either side, right or left. May result in cardiomegaly. Cardiomegaly, breaking that term down, is abnormal enlargement of the heart. And it is common in the elderly. We have carditis. Looking at that term, you can break that down. It means inflammation of the heart. Card is heart, itis is inflammation. We have endocarditis, endo is within. So inflammation of the inner lining of the heart. We have pericarditis, peri surrounding, inflammation of the pericardium. And then myocarditis, myo is muscle, so it's inflammation of the myocardium of the muscle. We have cardiomyopathy. It's a term to describe all disease of the heart muscles. Cardio is heart, myo muscle, pathy is disease. Heart valves. So the first, the heart murmur. Heart murmur is an abnormal blowing or clicking sound heard when listening to the heart of a neighboring large blood vessel. Usually does not require surgery unless patient's quality of life is affected. The valvulitis, inflammation of the heart valves. Again, you can break that medical term down. Itis, inflammation. Valvula is valve. The valvular prolapse is just an abnormal protrusion of the heart valve. Valve cannot close completely. We have valvular stenosis. This is a narrowing, stiffening of the heart valves. Cardiac arrest and arrhythmia. Cardiac arrest is loss of normal rhythm of heartbeat. And the next one we have here. So the cardiac arrest, obviously, if you person has a cardiac arrest, the heart abruptly stops beating. Asystole is without, systole is contraction, but complete absence of electrical activity in the heart. Sudden cardiac death, this obviously occurs when treatment of cardiac arrest is not provided quickly. The person would die from that. Heart block, congenital or acquired arrhythmia, electrical signal unable to reach ventricles. We have bradycardia, heart rate below 60 beats is considered bradycardia. Brady is slow, cardia is heart, I is abnormal condition. Tachycardia then would be rapid heartbeat, heart rate above 100 beats per minute. We have supraventricular tachycardia. So what this is, it's a rapid, regular heartbeats originate at or above the AV node. We have ventricular tachycardia. This is rapid heartbeats beginning within the ventricles, and this may be fatal. We have fibrillation. This is potentially life-threatening, fast, irregular heartbeats. Atrial fibrillation, the contractions of atria become rapid and uncontrolled. Next one we have is ventricular fibrillation, also known as VTAC, rapid irregular contractions of ventricles, and this may cause sudden death. We have palpitation, pounding, racing heartbeats, may be due to heart disorder or may occur during panic attacks. We have vasculitis. These are blood vessel abnormalities. Vasculitis is inflammation of the blood vessel. Polyarteritis involves several medium and small arteries. You can see poly is many, arter is artery. Temporal arteritis. Some symptoms, if you have temporal arteritis, is headache, visual impairment, and jaw pain. Angiostenosis. Looking at that term, angio is vessel, stenosis is abnormal narrowing. So it'd be your abnormal narrowing of a blood vessel. Hemiangioma, it's a benign tumor composed of newly formed blood vessels. Hem is blood, angi, blood or lymph vessel, and oma is your tumor. But it is a benign tumor. Hyperperfusion, this is just a deficiency of blood passing through an organ or body part. Looking at the arteries, first we have is aneurysm. So an aneurysm is a localized weak area or enlargement of the wall of an artery. We have arteriosclerosis. Arterio is artery, sclerosis is abnormal hardening, you break that term. So it has a loss of elasticity of arterial walls. Then we have arteriostenosis. So the stenosis was abnormal narrowing, arterio is artery, so it's narrowing of artery or arteries. We have veins. Chronic venous insufficiency is just partial vein blockage caused by inadequate venous circulation. Medical term they give us here is phlebitis. Phleb is vein, so it's just inflammation of the vein. We have varicose veins. These are abnormally swollen veins due to improper functioning of valves. Thromboses and embolisms. The first one we have is thrombosis. Thromb is clot. Os is abnormal condition or disease, so it's having a thrombus. Thrombus then is a blood clot attached to the interior wall of the vessel. Thromb is clot. EUS is singular noun ending. And then the thrombotic occlusion is blocking up an artery by a thrombus. We have coronary thrombosis. It's the damage to heart muscle due to thrombus blocking a coronary artery. Then we have the deep vein thrombosis. This is where the thrombus attached to the interior wall of a deep vein. Embolism, EMBOL, is something inserted in this condition. So it's a sudden blockage of a blood vessel by embolism. Embolus is a foreign object circulating the blood, maybe a blood clot, quality of air, gas, or piece of tissue or tumor. Peripheral vascular diseases. So the disorders of blood vessels located outside the heart or brain. We have peripheral artery disease, Raynaud's disease. With the Raynaud's symptoms include paleness, cyanosis, redness of the fingers and your toes. So this is a peripheral occlusive disease triggered by fluid. The peripheral is impaired circulation caused by atherosclerosis. We have blood dyscrasia. This is any pathological condition of cellular elements. And again, looking at that, we can break that down. Dys is bad, crasia is a mixture or blending. We have hemochromatosis. This is genetic. Intestines absorb too much iron, causing its accumulation in organs. Leukopenia, breaking the term down, leuco is white, penia is indeficiency. So decrease the number of disease-fighting white blood cells. We have polycythemia, excessive production of red blood cells by bone marrow. We have sepsis, infection in the bloodstream. Sepsis, also another name would be septicemia, would be also fit there. We have thrombocytopenia, is an abnormally small number of circulating platelets, often associated with abnormal bleeding. We have thrombocytosis, an abnormal disease in circulating platelets. And both of those terms you can break down. You can see the first one, thrombocytopenia, thrombos clot, cytosalpinea deficiency. And then the second term, thrombocytosis, is thrombocyte cell. And then your osis would be your abnormal condition. Hemorrhage, hemo is blood, regia is bleeding, so loss of large amount of blood. Transfusion reaction is a serious and potential fatal complication of a blood transfusion because the patient's blood and the donated blood do not match. It could be fatal. We have cholesterol. Cholesterol is just fatty substance traveling through the blood. We have hyperlipidemia. Hyper is excessive. Lipid is fat. Hemia is blood condition. So it's a general term for elevated level of cholesterol. Leukemia, myelodysplastic syndrome. It's cancer due to insufficient production of one or more types of blood cells. This may progress to acute myeloid leukemia. Looking at the term leukemia, LEUK is white, hemia is blood condition. Cancer characterized by progressive number of abnormal leukocytes in tissues, organs, and blood. Type is based on rate of progression and type of white blood cells involved. We have anemia. Looking at the term anemia, AN is without or less than. Anemia is blood condition, so it's a decreased number of erythrocytes. We have aplastic anemia, the absence of all foreign blood elements. And then we have iron deficiency anemia, and that's due to insufficient amount of iron. Megaloblastic anemia. Megalo is large, blast is immature, IC is pertaining to its larger than normal red blood cells is what that term would mean. This condition usually results from a deficiency of folic acid or vitamin B12. We have pernicious anemia. This is due to the body's inability to absorb vitamin B12. We have hemolytic anemia. Hemo relating to blood, lytic is to destroy. So this is an inadequate number of circulating red blood cells, premature destruction of red blood cells by the spleen. Sickle cell anemia, this is a genetic. It's abnormal hemoglobin resulting in some red blood cells, assuming sickle shape. Next we have thalassemia. This is inherited. It's due to reduced hemoglobin and fewer red blood cells than normal. Okay, moving on to hypertension. So hypertension is an elevation of arterial blood pressure. It may cause damage to the cardiovascular system. We've got a few types of them. We have essential hypertension, secondary, and malignant hypertension. This is also known as high blood pressure. Hypotension then is a lower than normal arterial blood pressure. Then we have orthostatic hypotension. Occurs when you're upon standing, you get the hypostatic hypotension at a fast. Angiography. Angio is blood vessel. Graphy is process of recording. So radiographic study of blood vessels after injecting of contrast medium. We have cardiac catheterization. Catheter is passed into a vein or artery and guided into the heart. That's what they do with that. Digital subtraction angiography, subtracting of soft tissue and bones from images with computer assistance. We have a duplex ultrasound, diagnostic procedure to image vessels and blood flow, and then we have a venography, viewing of specific veins after they inject the dye. We have electrocardiography. Looking at the term, you can break it down. Electro is electric, and then cardio is heart. This is a non-invasive procedure, recording of electrical activity of the myocardium. We have an echocardiogram, or EKG, or ECG. Gram is picture record. So it's just a record of electrical activity of the myocardium. Well, we have a Holter monitor. This is a portable EKG worn by ambulatory patients. It monitors the heart rate rhythm for 24 to 48 hours. We have a stress test, monitoring with EKG while patient exercises on treadmill or is injected with a chemical to increase the heart rate. We have the thalamium stress test, injecting thalamium and assessing blood flow through coronary arteries during exercise. Next, they talk about the treatment procedures. So obviously you can be treated with medications. The antihypertensive, or it just lowers the blood pressure. The ACE inhibitor blocks enzymes that cause vessels to contract. Then we have the beta blocker, which just slows the heartbeat down. We also have the calcium channel blocker agents. decreased movement of calcium into cells by relaxing heart and blood vessels, and the diuretic increases secretion of urine to rid body of excessive sodium and water. Antiarrhythmic controls irregularities of the heartbeat. The anticoagulant slows the coagulation, and then the aspirin, which reduces the ability of blood to clot. We have the cholesterol-lowering drugs. The digitalis, these slows the heart rate. This slows the heart rate. And then we have the thrombolytic, which just dissolves thrombi or clot. Looking at that term, you can break it down. Thrombos, clot, lytic is to destroy. You're just going to destroy that blood clot. With the tissue plasminogen activator, this dissolves damaging blood clots. With the vasoconstrictor, causes narrowing of the blood vessels. Vasodilator causes expansion of blood vessels. And then the nitroglycerin relieves pain of angina. Some nutritional interventions, they say to restrict sodium intake, decrease intake of fast food or processed foods, and then limit your cholesterol intake. Cardiac surgery, they have the cardiopulmonary bypass, or the CPB, also known as a heart-lung machine. Angioplasty, mechanically widening or obstructive vessels. So looking at that term, angio is blood vessel plasty surgical repair. You have the percutaneous transluminal coronary angioplast. You have the laser angioplasty also. So the laser removes plaque using beams of light, where the percutaneous flattens plaque and stretches lumina of vessel. We have a stent. This is a wire mesh tube supporting arterial wall. Atherectomy can also be done at surgical removal of plaque. Carotid endarterectomy is removal of a portion of the clogged carotid artery. Coronary artery bypass graft, or CABG, or cabbage, as we like to say. It's a portion of the vein from leg or chest is implanted, replaces blocked coronary artery, and improves blood flow to the heart. Cabbage is how they have that. Some treatment of cardiac arrest and arrhythmias. So they have the defibrillator, automated external defibrillator, AED, and they have the artificial pacemaker, implantable cardioverter defibrillator. They have a cardiac ablation, valvuloplasty. Here, this term is a medical term. You can break down valvular valve, plasty surgical repair. They have the heart valve replacement, where replacement of a heart valve, usually it's the aortic or mitral. They have the transcatheter aortic valve replacement, the cardiopulmonary resuscitation, CPR, or the compression-only resuscitation. Blood vessels, blood and bleeding. Here are a few here. You've got aneurysm clipping. This is a placement of clip at the neck of the aneurysm. Aneurysmorrhaphy, surgical suture of an aneurysm. And then aneurysmectomy, surgical removal of an aneurysm. Arteriectomy, breaking that term down, arter is arteryectomy, surgical removal. Hemostasis, hemo is blood, stasis stopping or controlling. So it's stopping or controlling of bleeding. Plasmapheresis is removal of blood and separation of cellular elements. And that is it for our chapter. All right. Please go to your workbook and complete the exercises for this chapter. There's several out there for you to do. Thank you for listening.